Hello and namaskar. This is me, Dr. Saraj Bhattrai, Senior Orthopedic Resident in Asrelani Hospital, Cairo University. Today I am going to describe about the bone of arm, that is humerus. Okay, uh, this is the humerus. You can see. So humerus is the long bone. It's the typical long bone. It develops by cartilaginous ossification. Okay, coming towards the side determination, how can we determine this is left or right? So left and right is determined by the head and the lower end. Okay, the upper end has the head, hemispherical head, which is directed medially, and the lower surface contains some structures like capitulum, trochlea. And how we can determine anterior and posterior is that anterior surface has the olecranon fossa. Okay, this olecranon fossa. So keeping it into the position left and right, so how can we put? So this should be medial, and this fossa should be posterior. So talking about the parts of the humerus, uh, upper end, the shaft, and the lower end. Upper end consists of the hemispherical head, which articulates with the glenoid cavity of the scapula. So we have the greater tuberosity, the lesser tuberosity. Okay, the greater tuberosity and the lesser tuberosity, and the anatomical neck and the surgical neck, that is the junction between the upper part and the shaft, that is the surgical neck. And we have a groove that for the passage of the long head of long head of tendon of biceps, there is a groove which is called a bicipital groove. The bicipital groove consists of medial lip, lateral lip, and the floor. So you can see here the medial lip, the lateral lip, and this is the floor. Okay, and coming towards the lower end, the lower end consists of the ball-like process. Okay, ball-like process, which is called the capitulum, and there is a trochlea. This is called the trochlea, and there is three fossa. Okay, the olecranon fossa, the coronoid fossa, and the radial fossa. Okay, and then we have the two epicondyles, medial epicondyle and lateral epicondyle. How we going to, if only this part is given, how we can differentiate the medial epicondyle and the lateral epicondyle? So medial epicondyle is more prominent. Okay, medial epicondyle is more prominent than lateral epicondyle. Okay, so talking about the shaft of the humerus, there are three surfaces and three borders. Okay, three borders are anterior border, medial border, and the lateral border. So where are the borders? I will explain you. The anterior border, the upper part of the anterior border is the continue with the lateral lip of the bicipital groove. It comes down, and the lower part is smooth. Okay, lower part is smooth. And talking about the medial border, it comes from the lesser trochanter down to the medial epicondyle, and to the lateral border it comes from back of the greater tuberosity. Okay, greater tuberosity down to the lateral epicondyle. Okay, okay, so now I will tell you about the muscle attachments. Okay, so first I will tell you about the muscle attachments of the upper end. Okay, you can remember the muscle attachment of the greater tuberosity like SIT. Okay, for S for supraspinatus, I for infraspinatus, and T for teres minor. Okay, this attached in the greater tuberosity, and the subscapularis muscles, it is inserted into the lesser tuberosity. Okay, and in the bicipital group, okay, in the bicipital group, remember as TLP. Okay, TLP. So in the medial lip, teres major, and in the floor, latissimus dorsi, and in the lateral lip, it's pectoralis major. So coming to the shaft for the muscle attachment, remember as BCD. Okay, B, C, and D. B is brachialis. Brachialis muscle is arise, not inserted. It arises from the anterior aspect, lower anterior aspect of the humerus. Okay, the brachialis. And C, coracobrachialis. It is inserted in the middle of the medial border. okay, in the middle of the medial border. And then C, B, C, D, and the D is inserted. D means deltoid muscles. Okay, D is inserted in this deltoid tuberosity. Okay, you can see here a tuberosity. This is a deltoid tuberosity. Okay, so there are three muscles which arise from the supracondylar ridges. From the lateral supracondylar ridges, two muscles arise from here. Okay, uh, first is the brachioradialis, and the second is the extensor carpi radialis longus. Okay, and from the medial supracondylar ridge, the pronator teres muscles arise from here. Okay, so this is the humerus and this is the ulna. It will lodge like this. Okay, the movement is like this, flexor and extension. Okay, while flexing the forearm, the coronate process will lodge in the coronate fossa. Okay, here and here the olecranon process will lodge in the olecranon fossa. Okay, thank you so much. I hope this video gets you well. Thank you so much.